Hi, my name is Kim. I'm going to be your student nurse for today, and I'm going to be completing an abdominal assessment, if that's okay with you.
Yep.
Okay, thank you. So first, I would go ahead and I would close the door, or I would pull the curtain to provide privacy. Can I have you state your name and your date of birth, please?
Michael Robinson, June 30th, 1997.
Okay, thank you. And I see that your medical record number matches what I have on the computer. Okay, so first I'm going to ask you a few questions. How has your appetite been? Have you had any changes recently?
Nope, it's been pretty normal.
Okay, when was your last bowel movement?
This morning.
Any changes with your normal, your usual bowel patterns?
Nope.
Any trouble urinating?
Nope.
Any nausea, vomiting?
Nope.
Have you been experiencing any increased gas or bloating?
I have not.
Okay. Have you had any recent abdominal illnesses or infections?
Nope.
Okay. And are you experiencing any pain?
I'm not.
Okay. So then if he was experiencing pain, I would have him rate the pain on a scale from 0 to 10, and I would assess the pain using old cart. So next I have just a few general questions. Approximately what is your average alcohol intake per week?
I would say it's about average.
Okay. And then what is your stress level?
Pretty normal.
Okay. And are you taking any over-the-counter medications or prescription medications, vitamins or supplements or herbals?
I take a multivitamin.
Okay. And are there any cultural considerations or religious preferences that you'd like me to be aware of?
Nope.
Okay. So next I'm going to move on to inspection. So that means I'm just going to look at your abdomen. So I would then go ahead and I would expose his abdomen. So I'm looking to see that I see that your abdomen is flat. It's not rounded or distended or concave. I do not see any wounds or scars or any masses such as hernias. And I see that your skin color is within defined limits and there's no discoloration that I can see, which is good. Okay, so next I'm going to move on to auscultation. So that means I'm going to listen. So I'm going to use the diaphragm of my stethoscope, and starting in the right lower quadrant, I'm going to be listening for 5 to 30 vowel sounds per minute. And I'm going to listen in all 4 quadrants. Okay, so I hear that vowel sounds are normal. So now I'm going to use the bell of my stethoscope and I'm going to be listening for the presence of bruits. So I'm going to start up at the aortic artery. And I'm going to move down to your right and your left renal arteries. And then I'm going to move down to your left and right iliac arteries. Okay, and I don't hear any bruits, which is good. Okay, so lastly, I'm going to move on to palpation. So I'm going to gently press down on your belly area. Are you feeling any pain or tenderness in your area? Okay, because if he was feeling any pain or tenderness, I would palpate that area last. So starting again in the right lower quadrant, I'm going to gently press down. And I am assessing the size and the placement of your organs, as well as looking for the presence of any masses or any of the presence of fluid, as well as tenderness when I push down. Okay, are you feeling any tenderness when I push?
Nope.
Okay, all right, and with that, that is the end of the abdominal assessment.
All right.
Okay, thank you.